New research shows that the number of babies born addicted to drugs has increased 1,000% since the start of the century. Now, neonatal intensive care units across the state are working equally as hard to care for them. Our Holly Hare joins us live in the studio with more on how local doctors are weighing in. Holly.
Yeah, Shannon, it's a growing issue locally and nationally, and it's referred to as Neonatal Abstinence Syndrome. The condition is acquired by an expecting mother's drug addiction. A local neonatologist spoke to us today on how these latest statistics play out in her unit. In a research study conducted by the PA Healthcare Cost Containment Council, babies born addicted to drugs are on the rise. To put things into perspective, 1,000% on the rise since the start of the century.
Unfortunately, I'm not surprised.
Dr. Andreyko is a clinical neonatologist in WellSpan's intensive care unit. In Lancaster County, nearly 12 out of every 1,000 babies born suffer from a condition called Neonatal Abstinence Syndrome, a condition of withdrawal.
They may be on methadone, Subutex, or this could be oxycodone or Percocet that they're taking regularly. When they take that during pregnancy, those medications actually pass on to the baby.
The effects on the baby takes a toll. Withdrawal symptoms often require morphine for pain, sleepless nights, and difficulty feeding, just to name a few. This makes baby's first homecoming far from reach.
The last thing that we want to do is just continue to throw medicine at them. The more morphine that they're on, the longer that they are in the hospital. It can be a 2 to 3 week stay in the NICU while we start the medication, and then we slowly wean the medication off the babies.
NAS stays accounted for $14.1 million in hospital payments in 2017. 137 came from Lancaster County. But no dollar amount will equal the price a child pays for a rough start at life.
I thought a lot about this because we do see these babies, and especially when you see the babies just crying and they're not consolable, you're like, gosh, what can we do about this?
As it turns out, Dr. Andreyko has a few ideas, and they start right here in the community.
Yes, there is a physical dependence to this, but I really do think we need to start focusing on the community support and the social support system so that people aren't turning to drugs.
Dr. Andreyko also mentioned alternatives to babies' rehabilitation, including a Mama-Roo, which is the rocker you saw in that video, and soothing music. However, she says withdrawal symptoms can continue after a baby is discharged, but she offers help at home as well. Reporting live in studio, I'm Holly Hare. Shannon, back to you.